Good afternoon. My name is Dr. Samuel Kinyanjui. I'm the Country Director for AIDS Healthcare Foundation, also known as AHF Kenya. I have a long history of engagement with the Global Fund. I have very many things to say that are very positive about Global Funds because it has been a transformative funding mechanism. I can remember the days in the 90s when we could not access ARVs for the patients, and we had challenges dealing and finding TB patients. And the coming of the Global Fund has really been transformative for this country and for Africa, because I have had experience working in this country, working in several countries in Africa, and a small stay in Far East country of Cambodia. In particular, I'd like to recognize the Global Fund for the transformative approach to health system. First, because of requirement for core funding or counterfeit funding from government, it has helped the country increase domestic financing towards both HIV and TB programs, also malaria. The other approach that is also very, very commendable is that the access to ARVs transformed many lives, saved millions of people, including in this country. We can also remember Global Fund's approach, unlike most other funding, the requirement and use of local systems. This allows the local people capacity to increase. We have capacity building of health systems, the use of government machinery that improved the health systems. In addition, one of the other things that I recognize Global Fund highly for is fighting stigma. How? By involving the people who live with HIV in the design and in the implementation, by involving civil society and other stakeholders. Global Fund, the country mechanism, the country coordinating mechanism, is a very good platform that has built and empowered community and communities, as we call them, as people living with HIV and AIDS. TB, people who have recovered or who are currently have TB, they have a place and a voice and a platform that is not only known in the country, but also respected across the board. Global Fund will also be remembered for what it has done in the area of empowering the communities with the involvement of community health workers. And these are very good things that we can remember. In addition, investing in the diseases, TB and HIV, Global Fund has had funding towards the health system strengthening, improving coordination. Another very highly notable feature of Global Fund, it is that is a results-based financing. I remember the days that we could remember working in the counties, then working in Eastern Province in Embu, and my partners working in the healthcare, in the HIV/AIDS, I was working in TB. They did not understand what we mean by measuring outcomes. But the moment Global Fund demanded that we start measuring outcomes, we start measuring the number of people retained, cohorts retained on care, number of people who are attaining the viral suppression, the health sector, the quality of care provided to people living with HIV and AIDS tremendously has increased. The quality of care not only increased, but the outcome and the wellness of these people is not comparable. We did our first, check of results. I think that was 2004. And for the year 2004-2005, for the people who had been registered in Eastern Province for treatment, by the end of the year, we could not account for 40% of the people. We didn't know where they were. But the Global Fund insistence on the results, we know that the retention is now, as for our country, more than 80%. And we know the number of virally suppressed people out of the 80% is way close to the 90s. This is transformative. And we actually believe, personally I actually believe, if we can use this result-based approach beyond Global Fund, maybe towards universal health coverage, then the health system, particularly in the developing countries, would be transformed for the better. Thank you very much, and I wish Global Funds long life, and I believe that we can get additional funding that can go beyond the 3 diseases into UHC in the days to come. All the best. My name is Dr. Samuel Kinyanjui. I represent civil society in this country, and I accept the Global Fund caravan torch into Kenya. And I wish Global Fund the best birthday, 20th birthday, and I wish the Global Fund many more productive years ahead. Thank you.